Let me ask you a quick question. What if one of the most common, cheapest things sitting in your medicine cabinet isn't just for headaches, but plays a role in keeping arteries from turning into clogged pipes? Most people think aspirin is just for pain, but very few understand what it actually does inside your blood vessels. And when you understand this, it completely changes how you look at heart health. Here's the big idea. Clogged arteries are not just about cholesterol. That's where most people get confused. The real problem starts with inflammation and damaged artery walls. When the inside of an artery gets irritated, your body sends in platelets like tiny repair workers. But if that irritation keeps happening, those platelets start sticking together too much. Over time, this can contribute to plaque buildup and restricted blood flow. This is where aspirin gets interesting. Aspirin doesn't magically scrape plaque out of your arteries. That's not how it works. What it does is reduce excessive platelet clumping. Think of it like making your blood less sticky. When platelets are less likely to clump together, blood flows more smoothly, especially through narrow or inflamed arteries. Another important point is inflammation. Chronic, low-grade inflammation is one of the biggest drivers of artery damage. Aspirin has an anti-inflammatory effect, which means it can help calm down the irritation inside blood vessels. Less inflammation means less damage. Less damage means fewer signals telling platelets to rush in and pile up. Now here's something most people don't realize. The real danger in clogged arteries isn't always the plaque itself. It's when a plaque becomes unstable and suddenly triggers a clot. That clot can block blood flow to the heart or brain in seconds. By reducing platelet aggregation, aspirin lowers the risk of sudden clot formation in people who are already at high risk. But this is very important. Aspirin is not for everyone. If your arteries are healthy, if you don't have inflammation, or if you have bleeding issues, aspirin can do more harm than good. This is why blindly taking it just in case is not smart. It has to match your situation. What I personally focus on first is fixing the root causes of artery damage. Lowering sugar intake, reducing refined carbs, increasing healthy fats, managing stress, improving sleep, and getting key nutrients that support the arterial lining. Aspirin is not a replacement for these basics. It's more like a support tool in specific cases. Another thing to understand is timing and context. Aspirin works best when inflammation and clot risk are already present. It doesn't undo years of poor diet, it doesn't cancel out smoking, and it doesn't protect you from constant insulin spikes. Those things damage arteries far more aggressively than most people realize. Also, natural blood flow support matters. Nutrients like vitamin K2, magnesium, omega-3 fats, and antioxidants help keep calcium where it belongs and support flexible arteries. Without these, aspirin alone is not enough to make a meaningful difference. So when people say aspirin unclogs arteries, that's not really accurate. What it does is help prevent the processes that make arteries worse. It reduces excessive clotting, calms inflammation, and helps blood move more freely through already stressed vessels. The biggest takeaway is this. Heart health is not about one pill. It's about reducing inflammation, stabilizing blood sugar, protecting the artery wall, and supporting normal blood flow. Aspirin can play a role for some people, but it should always be part of a bigger strategy, and it should always be discussed with a qualified healthcare professional. If you understand what's really clogging arteries, you stop looking for miracle fixes and start focusing on what actually keeps blood vessels open, flexible, and healthy long term. Let's slow this down and really unpack this, because this is where most people get misled. When you hear clogged arteries, almost everyone immediately thinks cholesterol. They imagine fat floating around in the blood, sticking to artery walls, and slowly blocking blood flow like grease in a pipe. That idea has been repeated for decades, but it leaves out the most important part of the story. Cholesterol by itself does not randomly stick to healthy arteries. The real trigger is inflammation and damage to the inner lining of the blood vessel. Your arteries are lined with a very thin, delicate layer called the endothelium. This layer is supposed to be smooth, flexible, and protective. When it's healthy, blood flows effortlessly, and cholesterol particles pass by without causing problems. But when that lining becomes irritated or damaged, everything changes. And what causes that damage? Chronic inflammation from things like high sugar intake, insulin resistance, smoking, constant stress, poor sleep, and nutrient deficiencies. Once inflammation shows up, the body reacts as if there's an injury. Platelets are sent to the area to help repair the damage. Platelets are not bad, you need them to survive. They help stop bleeding when you get a cut. The problem starts when platelets become overactive. In an inflamed artery, platelets begin sticking to the damaged area, then sticking to each other. This creates a sticky environment inside the blood vessel. Now, here's where cholesterol enters the picture, but not in the way most people think. Cholesterol doesn't initiate the problem. It gets trapped in the damaged area as part of the body's attempt to patch things up. Over time, this combination of platelets, cholesterol, calcium, and inflammatory debris forms plaque. So plaque is more like a scar than a simple fat deposit. It's a response to injury, not the original cause. This is why focusing only on lowering cholesterol numbers misses the root issue. You can have normal cholesterol and still develop artery disease if inflammation and platelet overactivity are present. On the flip side, some people have higher cholesterol but healthy arteries because their inflammation levels are low and their artery lining is intact. This is where aspirin becomes relevant. Aspirin does not clean arteries. It does not dissolve plaque. And it does not reverse years of damage overnight. What it does is target platelet behavior. Aspirin makes platelets less likely to clump together excessively. In simple terms, it reduces blood stickiness. When blood is less sticky, it moves more smoothly through narrow or irritated areas of arteries. Aspirin works by blocking certain chemical signals that platelets use to activate and aggregate. Without those signals, platelets are still able to do their basic job, but they are less likely to form large, dangerous clumps. This is especially important in arteries that are already inflamed or partially narrowed, where blood flow is more turbulent and clot formation risk is higher. Another key point is inflammation itself. Aspirin has anti-inflammatory effects, which means it helps calm the immune response inside the artery wall. Less inflammation means less endothelial damage. Less damage means fewer platelets being called to the area in the first place. This creates a protective loop where the artery lining is under less stress. The most dangerous moment in artery disease is not always slow plaque buildup. It's when a plaque becomes unstable. An unstable plaque can rupture suddenly, exposing the inner contents to the bloodstream. When that happens, platelets rush in aggressively, forming a clot within minutes. That clot can completely block blood flow to the heart or brain, leading to a heart attack or stroke. This is why platelet control is so important in high-risk individuals. By reducing platelet aggregation, aspirin lowers the likelihood that a sudden rupture will turn into a full blockage. That's why aspirin has historically been used in people who have already had heart-related events or who have clear risk factors. It's not acting as a cleanser, it's acting as a stabilizer. Now, this is where context matters. Platelet overactivity doesn't happen in isolation. It's strongly linked to blood sugar problems. When blood sugar is consistently high, it damages the artery lining and makes platelets more reactive. Insulin resistance also thickens the blood and increases inflammation. This is why people with metabolic issues often have higher clotting risk, even if their cholesterol looks fine on paper. Stress plays a role as well. Chronic stress increases cortisol and adrenaline, which can make platelets more aggressive and blood vessels more constricted. Poor sleep amplifies inflammation. Smoking directly injures the endothelium. All of these factors create the perfect environment for platelet clumping and artery damage. This is why aspirin alone is never the full answer. If inflammation remains high, platelets will keep being activated with or without aspirin. The foundation has to be reducing the sources of inflammation. That means stabilizing blood sugar, cutting back on refined carbohydrates and sugars, improving sleep quality, managing stress, and supporting the body with proper nutrition. Nutrients are critical here. The artery lining needs magnesium to relax and stay flexible. Vitamin K2 helps guide calcium away from artery walls. Omega-3 fats help reduce inflammation and platelet overactivity naturally. Antioxidants protect the endothelium from oxidative damage. Without these, the artery wall remains vulnerable. Another misunderstood point is that not all plaque is the same. Stable plaque is less likely to rupture. Inflammation turns stable plaque into unstable plaque. Aspirin's role in reducing inflammation and platelet activity can help reduce the risk associated with unstable plaque, but it does not remove the underlying structure that has already formed. This is also why aspirin is not a preventive tool for everyone. If someone has low inflammation, healthy blood sugar, intact artery lining, and no clotting risks, suppressing platelets unnecessarily can increase bleeding risk without offering benefit. Platelets are essential for normal healing, and interfering with them when there's no problem can backfire. The real takeaway from this keynote is that clogged arteries are not a simple cholesterol problem. They are a complex inflammatory process driven by endothelial damage and excessive platelet activity. Aspirin's role is not to unclog, but to reduce clot risk and calm inflammation in specific situations where platelets are part of the problem. When you understand this, you stop looking at heart disease as a numbers game and start seeing it as a systems issue. Fix the inflammation, protect the artery lining, stabilize blood sugar, and platelets naturally behave better. Aspirin may support this process in certain high-risk cases, but it should never be viewed as a shortcut or a substitute for addressing the true causes of artery damage. Let's clear up one of the biggest misunderstandings about aspirin right away, because this confusion causes a lot of people to either overuse it or expect results it can never deliver. Aspirin does not remove plaque from arteries. It does not scrape cholesterol off artery walls, and it does not reverse years of damage like a drain cleaner. That idea sounds appealing, but it's not how the body works. To understand what aspirin actually does, you have to understand what plaque really is. Plaque isn't just fat sitting there. It's a complex mix of cholesterol, calcium, inflammatory cells, connective tissue, and platelets. Think of it as a patch your body built in response to injury inside the artery. Once that patch forms, the body doesn't easily remove it. It can stabilize it, shrink it slightly over time with major lifestyle changes, but there's no pill that simply dissolves it away. So if aspirin doesn't remove plaque, why has it been used for heart health for so long? The answer lies in clot prevention. The most dangerous part of artery disease is not slow narrowing over decades. The real danger is sudden blockage. That sudden blockage usually happens when a clot forms on top of an existing plaque. Here's how that happens. Plaque can sit quietly in an artery for years without causing symptoms. But if inflammation remains high, that plaque can become unstable. Its surface can weaken and rupture. When that rupture happens, the body reacts instantly. Platelets rush to the site just like they would if you cut your skin. Within minutes, a clot can form. That clot can completely block blood flow to the heart or brain, triggering a heart attack or stroke. This is where aspirin plays its role. Aspirin reduces the ability of platelets to clump together aggressively. It doesn't turn platelets off completely, but it lowers their reactivity. This makes it harder for a large, sudden clot to form on top of a ruptured plaque. In simple terms, aspirin helps prevent a bad situation from becoming a catastrophic one. Another important piece of this is inflammation control. Chronic inflammation weakens plaque and makes rupture more likely. Aspirin has anti-inflammatory properties, which means it helps reduce some of the inflammatory signals inside the artery wall. When inflammation is lower, plaques are more stable. Stable plaques are far less likely to rupture suddenly. So aspirin's benefit is not about cleaning arteries. It's about reducing risk. It's about lowering the chance that an existing plaque turns into an emergency. That distinction is critical because when people believe aspirin unclogs arteries, they may ignore the lifestyle factors that actually matter most. Blood flow itself is another part of this story. In narrowed or irritated arteries, blood flow becomes turbulent instead of smooth. Turbulent flow increases platelet activation. Aspirin helps keep blood flowing more smoothly by reducing stickiness. This doesn't widen the artery, but it reduces friction and clot risk in already compromised areas. Now let's talk about who actually benefits from this effect. Aspirin is most useful for people who already have a higher clot risk. That includes individuals with a history of heart attacks, strokes, stents, or known arterial disease. In these cases, the risk of clot formation is high enough that reducing platelet activity can be protective. For people without these risks, the picture is very different. Platelets exist for a reason. They protect you from excessive bleeding. When you suppress platelet function unnecessarily, you increase the risk of bleeding in places you don't want it, like the stomach or brain. This is why routine aspirin use in low-risk individuals has fallen out of favor. Another key factor is blood sugar. High blood sugar damages plaques and makes them more unstable. It also makes platelets more reactive. This means that someone with poor blood sugar control may have plaques that are far more dangerous than someone with similar plaque size but better metabolic health. Aspirin can help reduce clot risk, but it does nothing to fix blood sugar spikes that keep destabilizing plaque in the first place. This is also why insulin resistance is such a major driver of cardiovascular events. Insulin resistance increases inflammation, thickens the blood, and increases clotting tendency. Aspirin may lower platelet aggregation. But if insulin resistance remains unchecked, the underlying risk continues. Stress plays a role here as well. Chronic stress raises stress hormones that increase blood pressure and constrict blood vessels. This puts mechanical stress on plaques, making rupture more likely. Stress hormones also make platelets more aggressive. Aspirin can dampen some of that platelet response, but it cannot neutralize constant stress signals. Smoking is another example. Smoking directly damages plaque surfaces and increases clotting risk dramatically. Aspirin may offer some protection, but it cannot counteract the ongoing injury caused by smoking. This is why aspirin is never a substitute for removing the behaviors that destabilize plaques. Nutrient status also matters more than most people realize. Low magnesium increases vessel stiffness and raises clot risk. Low omega-3 intake increases inflammation and platelet aggregation. Vitamin K2 deficiency contributes to calcium buildup in plaques, making them more brittle and unstable. Aspirin does not correct these issues. So when you hear the phrase aspirin prevents heart attacks, what it really means is this: aspirin can reduce the likelihood that an existing plaque triggers a sudden clot in certain high-risk individuals. It does not stop plaque from forming and does not undo existing damage. This is also why aspirin should never be viewed as a long-term safety net that allows someone to ignore diet and lifestyle. You can't out-aspirin chronic inflammation. You can't suppress platelets enough to overcome constant sugar intake, poor sleep, and high stress without creating serious side effects. The smartest way to think about aspirin is as a stabilizer, not a fix. It stabilizes platelets. It stabilizes clot risk. It helps keep a bad situation from escalating. But it does nothing to repair the artery wall, restore endothelial function, or remove plaque. The real protection comes from addressing what made the plaque dangerous in the first place: lowering inflammation, stabilizing blood sugar, supporting the artery lining with proper nutrients, improving sleep, reducing stress. These changes reduce plaque instability naturally, often more powerfully than medication alone. So the takeaway from this keynote is simple but critical. Aspirin does not unclog arteries. It reduces the risk of dangerous clots forming on existing plaque. It can be life-saving in the right context, but useless or harmful in the wrong one. Understanding this distinction helps you make smarter decisions and focus on strategies that actually protect your heart long-term. This is where the conversation really needs to become honest. Because Keynote 3 is the part that most people want to skip. It's much easier to believe that one pill can protect you than to accept that daily habits are the real drivers of artery health. Aspirin is not for everyone, and it should never be used as a shortcut or a replacement for fixing what's actually damaging the arteries in the first P. Lace. Let's start with the idea that aspirin is harmless. It's not. Aspirin changes how your blood clots. That can be helpful in certain situations, but it also carries real risks. When platelet activity is reduced too much, the risk of bleeding goes up. That bleeding doesn't always show up as something obvious. It can happen in the stomach lining, the intestines, or in rare but serious cases, the brain. This is why using aspirin without a clear reason can actually create problems instead of preventing them. The benefit of aspirin depends entirely on your risk profile. If someone already has significant arterial disease, a history of heart attack, stroke, or clear clotting risk, the benefit of reducing platelet aggregation may outweigh the bleeding risk. But if someone has healthy arteries, low inflammation, and no clotting tendency, suppressing platelets offers little to no benefit and introduces unnecessary danger. Now let's talk about why fixing the root causes matters so much more than relying on aspirin. One of the biggest drivers of artery damage today is blood sugar instability. Every time blood sugar spikes, it creates oxidative stress inside blood vessels. That stress damages the endothelial lining, making it more inflamed and more attractive to platelets. Over time, repeated blood sugar spikes lead to chronic inflammation and plaque formation. This is why diets high in refined carbohydrates and sugar are so destructive to arteries. You can take aspirin every day, but if you're constantly flooding your bloodstream with glucose, the damage continues. Aspirin cannot protect the artery wall from sugar-induced injury. It only modifies how platelets respond after the damage has already occurred. Insulin resistance makes this even worse. When cells stop responding properly to insulin, the body produces more insulin to compensate. High insulin levels promote inflammation, fluid retention, and abnormal blood clotting. Insulin resistance also thickens the blood, making platelet aggregation more likely. Aspirin may slightly reduce clotting risk, but it does nothing to correct insulin resistance itself. This is why improving insulin sensitivity through diet, movement, and fasting strategies is far more powerful than any medication alone. When blood sugar and insulin levels normalize, inflammation drops, platelet activity becomes more balanced, and arteries experience far less stress. Stress is another major root cause that aspirin cannot fix. Chronic stress raises cortisol and adrenaline. These hormones increase blood pressure, tighten blood vessels, and make platelets more reactive. Over time, stress hormones create mechanical strain on artery walls and increase the likelihood of plaque instability. Taking aspirin while remaining in a constant stress state is like putting a small patch on a wall while the foundation continues to crack. Sleep plays a critical role here as well. Poor sleep increases inflammation, disrupts blood sugar regulation, and raises stress hormones. Even one night of poor sleep can increase platelet activation the next day. Chronic sleep deprivation compounds this effect. Aspirin does nothing to correct the hormonal and inflammatory damage caused by inadequate sleep. Nutrition is another area where aspirin falls short. The artery lining requires specific nutrients to stay flexible and resilient. Magnesium helps blood vessels relax and prevents excessive constriction. Omega-3 fats reduce inflammation and naturally calm platelet activity. Vitamin K2 helps direct calcium away from artery walls and into bones where it belongs. Antioxidants protect the endothelium from oxidative damage. If these nutrients are missing, arteries remain vulnerable no matter how much aspirin is used. In fact, nutrient deficiency. NCIEs can increase the risk of side effects from aspirin, particularly gastrointestinal irritation. Another important point is that aspirin does not improve endothelial function. The endothelium is responsible for producing nitric oxide, which allows blood vessels to dilate and maintain healthy blood flow. Poor endothelial function leads to stiff arteries and higher blood pressure. Diet, exercise, sunlight exposure, and certain nutrients improve nitric oxide production. Aspirin does not. This is why lifestyle changes often produce dramatic improvements in artery health even without medication. When inflammation drops and endothelial function improves, platelets naturally become less reactive. Blood flows more smoothly. Plaques become more stable. These changes address the cause, not just the consequence. There's also a psychological trap with relying on aspirin. When people believe they are protected, they may feel less urgency to change their habits. This false sense of security can lead to continued poor diet choices, inactivity, and unmanaged stress. Over time, the underlying disease progresses quietly, and aspirin alone is no longer enough to prevent a major event. Another issue is dosage and duration. Aspirin is not meant to be taken indefinitely by everyone. Long-term use increases the risk of stomach lining erosion and bleeding. Without proper medical oversight, people may take doses that are unnecessary or inappropriate for their situation. It's also important to understand that aspirin interacts with other medications and supplements. Combining aspirin with certain pain relievers, blood thinners, or herbal compounds can amplify bleeding risk. This is another reason why casual, unsupervised use is not advisable. The smarter approach is to view aspirin as a tool, not a solution. In the right person, at the right time, for the right reason, it can reduce risk, but it cannot compensate for chronic inflammation, poor metabolic health, or ongoing artery injury. True artery protection comes from creating an internal environment where damage is minimized. Stable blood sugar, low inflammation, balanced stress hormones, adequate sleep, proper nutrition, regular movement. When these foundations are in place, the body naturally maintains healthier blood flow and more stable plaques. So the real message of this keynote is simple but powerful. Aspirin should never be the starting point. The starting point is removing what's damaging the arteries in the first place. Once that foundation is addressed, aspirin may or may not be necessary, depending on individual risk. Heart health is not built in a pharmacy aisle. It's built in daily choices that reduce inflammation and support the artery wall. Aspirin can support the process in specific cases, but it can never replace the work of fixing blood sugar, improving diet, managing stress, and restoring nutrient balance. When you understand this, you stop looking for shortcuts and start focusing on what actually keeps arteries healthy long term.